First 2 weeks of May 2010. The survey was directed at hospital marketing executives, and we received a total of 250 responses. We've published these responses so that you can see what others are doing and you can compare yourself to other hospitals. This chart was produced by Mr. Ed Bennett, the Director of Web Strategy at the University of Maryland Medical Center. Mr. Bennett tracks hospitals who participate in Facebook, Twitter, and YouTube. As you can see, social media usage in healthcare is rising, and rising fast. Mr. Bennett also tracks the type of social media tools that are being used by over 730 hospitals. The big three are Facebook, Twitter, and YouTube, which, as you will see, is consistent with our survey findings. The first question in our survey identified the size of participating hospitals. More than 1/2 of the responses were from hospitals with less than 300 beds. The type of hospitals participating was diverse and included IDNs, teaching hospitals, cancer centers, community hospitals, long-term care facilities, and others. Surprisingly, as many as 64% say they have implemented social media. For those that answered yes to this question, they went to question number 5, so they skipped the next 2 questions. Of those that have not implemented social media, more than half plan to implement social media in the next 6 months. I think it's fair to say that hospitals see the value of social media as part of their overall strategy. Of those that have not implemented social media, 42% have already started to look at what others are doing, and 37% have started to develop a strategy. Surprisingly, only 1 out of 250 plan on doing nothing. This question was only answered by those that have already implemented social media, and respondents were allowed to provide multiple answers. Most of the hospitals are participating in Facebook, Twitter, and YouTube, with LinkedIn being the 4th most used social media tool. Respondents who have already implemented social media tools answered this question and were allowed to provide multiple answers. As you can see, there seems to be a lot of different ways where social media can add value. The most common drivers appear to be building brand and driving web traffic. Of the hospitals that have already implemented social media, it's surprising that 1/3 have done so without a strategic plan. Industry best practices recommend you should have a plan first, so that your social media initiatives align with your organization's goals, and you have thought through policies, different social media tools, content updating, staffing, etc. Similar to question number 5, hospitals were asked what tools they were planning on implementing. The top 4 social media tools were Facebook, Twitter, YouTube, and LinkedIn. As hospitals mature with the use of social media, we anticipate they will expand their usage to other tools, such as blogging and online communities, to interact and engage more with their patients. In terms of where hospitals see potential value, as you can see, almost all of the areas scored favorably. This clearly indicates that respondents see a lot of potential for social media to add value to their organizations. The 3 audiences or groups that would gain the most from social media are patients, marketing, and philanthropy. Given that hospitals are patient-centric, this is clearly a good thing. When seeking assistance, hospitals indicated they need help with measuring ROI, managing online content and conversations, and developing strategies and plans. ROI should be aligned with your hospital's goals, and analytical tools could be used to capture this data. Outsourcing may be an alternative to dealing with staffing issues and plan development. This slide shows a 3D social media maturity model as it relates to hospitals. The y-axis is value. The x-axis shows the 5 phases of social media maturity, and the z-axis shows the social media metrics of how hospitals are able to influence the patient. According to the survey, most hospitals are in the first 3 phases. observing, planning, and participating. To get the most out of social media, hospitals need to encourage sharing and become more fully engaged with their patients. Ideally, when you are sharing and engaged, you will have the most influence over patients and have the ability to direct desired actions and build long-term loyalty. This is where blogs and online communities can play a role to fully extend and get the most out of your social media presence and really differentiate your hospital. That concludes our overview of the social media usage in healthcare survey results. MyHealthCommunity specializes in social media for healthcare. We offer strategy and planning consulting, services to set up and manage your social media sites, and we have an online community platform that can be branded as your own and is available for a low monthly fee. If you'd like more information or wish to discuss your social media plans with one of our experts, we encourage you to contact us. We can arrange a conference call or a demo of our online community solution.